Our next presenter is David Perry.
Good morning, class. This morning I'm going to give you a class on aerodynamics, and we're going to talk about the first topic is what's the first topic? Gosh.
This is a classic case of speech anxiety. According to Dr. Louise Katz of the University of Tennessee at Martin, as many as 20 to 85% of people experience anxiety when they have to speak in public. Experiencing speech anxiety is normal. Nearly everyone gets nervous when they have to give a speech, even experienced speakers. Speech anxiety can range from slight feelings of nerves to nearly incapacitating fear. Recognizing what causes that fear and learning ways to cope with it can help minimize anxiety. I would like to explain reasons why many of us feel anxious about public speaking, describe some of the physical symptoms of speaking anxiety, and offer ways that you can learn to deal with and eventually overcome these feelings. Let's look into what exactly it is that makes us so incredibly anxious when it comes to speaking in public. According to a speaker's guidebook, there are 3 elements that enhance public speaking anxiety. The first of these is a lack of positive experience. This can be caused from having no exposure to public speaking, or if you have had exposure, it may have not been pleasant. The second element may stem from feeling different. This is where all of those insecurities come out and shine like a pair of oncoming moose lights. Getting up in front of an audience will cause speakers to feel extra sensitive about their lisp, accent, weight issue, bad haircut, or etc. The final element is being a center of attention. Being in front of all those people just staring at you, waiting for you to speak. It's enough to push anybody over the edge. Certain audience behaviors, such as a lack of eye contact, pointing or whispering, may cause speakers to feel as if they've done something wrong. Now that we have a small idea of why speakers feel anxiety, let's take a peek at what speech anxiety may look like. According to Dr. Louise Katz, there are often physical symptoms of speech anxiety. These symptoms include trembling or shaking, cold clammy hands, shaking voice, rapid heartbeat, sweating, blushing, dizziness, shortness of breath, digestive discomfort, or forgetting something you know or were about to say. In some cases, a person with speech anxiety may even experience a panic attack. Symptoms of speech anxiety can cause students to give up. In fact, according to an article in Communication Education, students confronted by serious anxiety in oral communication tend to drop out of the basic course. In one term at Michigan State, for example, over half of the students identified as suffering from moderate to severe speech anxiety during the first week of the term had dropped the course by the 3rd week. Speech anxiety is real. However, instead of giving up, let's look into ways that we can deal with these emotions and overcome the anxiety. According to a speaker's guidebook, meditation and visualization are among the ways that speakers can cope with their anxiety. However, the best methods are practice and experience. Have a thorough plan for each presentation and rehearse as many times as possible. If you are confident that you know your material, you are far more likely to feel confident when you're presenting. Speech anxiety can only control you if you allow it to. Acknowledging your feelings of anxiety and learning ways to deal with the physical and emotional symptoms that come with it can help you to see the enjoyment that can come from public speaking. I have described contributory factors to speech anxiety, physical symptoms of anxiety, and ways that speakers can cope with their anxiety. As said by Mark Twain, there are only 2 types of speakers in the world, the nervous and the liars. You are not alone.